Good evening, everyone, to the Unicorn Voices Toastmasters Club meeting number 21. Before we start, I would like to lay down a few ground rules. First of all, please be on mute unless it is your turn to speak. And please mute any noise-making devices that you may have around. If possible, keep your video on because it will be good for the speakers to see you. And then one thing that is slightly different from other Toastmasters Club is usually we say, please refrain from talking about topics on sex, religion, and politics. But here you can speak on those topics as long as you do not offend anyone. With that, let me call our president, Toastmaster Ritesh, whose brainchild this whole program is. Over to you, Toastmaster Ritesh.
Good evening, everyone. If you are comfortable, why don't you all switch your videos on? Seth, Sagnik, Shoptik, Siddhant. Uh, First, welcome to Unicorn Voices Toastmasters Club. We started as a safe space for everyone, uh, not just for LGBTQIA, but for women and anyone else who may feel that they need a safe space for sharing and caring. Today's session is interesting because it stems from a question I had posed to my own parents. And when I was talking about a health issue, they said, shh, don't talk about your health in that loud tone. Ever since the COVID has started and I'm used to speaking over Zoom, it appears so that my voice is modulated at a very high decibels. So wherever I speak from in house, everyone else can hear it, not just in my house, but in neighbors, which means I have no secrets as of June 2021. And mom's argument against me was, I just asked, do you think I should get tested for COVID? And this was the time when I had fallen ill very seriously. So it appears that health is a taboo issue in particular. You can't even talk about you falling ill. You're supposed to have 100% health all the time, every day of the week, every year of your life, till you die. So you are born and you die. What happens in between has no relationship to our health, whether it goes up or down. That's interesting because there are a lot of changes that happens with our health even under normal situation, and we do undergo a lot of changes. But when you come to marginalized communities, LGBTQIA, women, people with disabilities, some of it can be debilitating. It can be even harder for them to seek help, ask help, or even to find help because they may not have access to all of that. So this program today was visualized to at least raise a voice and awareness that health issues are real and it doesn't matter who you are. There are people out there who have been using their expertise to help people in different facets of health. So this panel was constituted by, with a group of people whom I thought will bring in their expertise from their walks of life and their fields. And we get to learn a bit on not just how to take care of ourselves, maybe offer advice or at least a direction if someone else is ailing. And there are a lot of issues we can think about. The pandemic at least brought health to everybody's attention, but we have been ignoring it as an important facet in our life. We took health for granted, we took preventive measures for granted, and we are stuck where we are today. So I thought that today's event that talks about this panel is the best way to have these conversations. Women in LGBTQI can't even talk about what ails them. There's no forum where they can start. And one of the questions we have received, in fact, we received 7 questions, and I'm going to start by asking those questions and the panelists will take over. But let me introduce our panelists before all of that happens. Our first panelist is Shabya. Ma'am, am I spelling your name correct? Because you are called Shoaiba here, so I'm confused.
It's pronounced Shoiba, it's written Shaibya, typical Indian name.
Okay, I guess I'll have to add up, yes. So let me introduce our first panelist for today. She is Dr. Shoiba. She is a doctor of obstetrics and gynecology. She is an associate professor at St. John's Hospital, Bangalore since 2000. She has also got diploma in counseling skills and she counsels both children and adolescents. She's a trainer for stakeholders like doctors, police, lawyers, NGOs, and judicial officers, where she engages in a multidisciplinary approach to child sexual abuse management. And she's also a sexuality educator. So please keep your hands and welcome our first panelist, Dr. Shoiba.
Thank you.
Our second panelist, for lack of a better plural word to define them, join us from Canada, Dr. David, Tilly, and Chris. They are a couple and they have been together since 1985. And since I didn't get a good amount of intro from them, I'm going to ask David and Chris to introduce themselves. David, Chris, the floor is yours.
Okay, I'm David Tilley. I've been retired. I'm a retired family doctor. I've been retired for 3 years. During my entire working career, since the mid 1980s, I had a practice that where I took care of almost entirely gay men. At the for the last, let's say, 15 years of my practice, I was a part of a large multidisciplinary clinic where we took care. It was primarily a gay men's health clinic in Toronto, Canada. And we had about a dozen family doctors, a psychiatrist, a psychologist, internal medicine specialist, and infectious diseases specialist. We provided, this was outpatient care for gay men, and then in particular, patients who were HIV positive and who had hepatitis C. At one point in our clinic, I think we were caring for 2,600 HIV positive patients. So it was a very rewarding career, and now I've been retired for 3 years.
I too am retired. My name is Chris Sharin, and I've qualified as a principal here in Canada. I ran a specialty program for gifted students in high school, so everyone in the program had to score in the 98th percentile. Amongst that were also about 200 to 300 students who also had learning disabilities as well as being gifted. I was a guidance counselor for that program, but I also was involved in starting a gay-straight alliance, what is known now, over 20 years ago in my high school. The Gay-Straight Alliance is simply a safe space for students to go to at lunchtime. And the phrase Gay-Straight Alliance, which is quite common here in North America now, didn't even exist. Today, it's mandated by law that all high schools and junior schools are to have such a club with a staff advisor if students request it. Since retiring, I've always had a strong yoga practice. I went as a gift to myself for retirement. I took my yoga teacher training, did 650 hours of yoga teacher training, and quite miraculously was invited to teach in Bangalore, Mysore, and Goa a couple of years ago, and that's how we met Ritesh. So that's my background, and I'm looking forward to hearing and the questions today and meeting the rest of the group.
Okay. We have a special moderator for today's panel, and this is none other than a very good friend and an ally of UATC Club. Ilavenil DTM, who will help moderate the session and get the questions and have a flow. So Ilavenil, would you be able to moderate part of the session at least? Okay. I'm going to I'm going to spotlight the panelists right now. Let's see. And let me put Dr. Shoiba also and Elevenil. Okay. So before I do so, let me read the 7 questions that we received anonymously, and the panel can start from there. Okay. So let me read out. So 7 questions we received anonymously, and whoever sent it, if you are in the room, if you're not in the room, thanks for sending this because it gave us enough fuel to begin this panel discussion. The first question is, what is sexuality? How is it connected to health? When does sexuality develop? At that age, is one sure of their sexuality? Does it change with time or does it remain the same? The third question is, how are the health needs of LGBT people different from us? So I believe this must have come from a straight person, which is a valid question to ask because they may want to know what health needs LGBT people have. Does sexual health affect me? Oh, that was an interesting question. The fifth question is, in this pandemic times, how can I take care of my health? Physical, mental, emotional, and sexual. The sixth question is also connected to the fifth. I stay alone and I work in a different city from where my parents and friends live. How can I take care of my health living alone? Sometimes I get scared that I will die alone due to COVID. What should I do when I think of these thoughts? And the seventh question, should women discuss their health needs in front of men, while the latter are so ignorant about the issues related to women's body and health? How do we even begin this discussion? Those are the questions, and I am going to put them in the chat box for everybody's help. So, yes, you can also view these questions. And panel, why don't you actually start? We will hear your tidbits on these 7 questions. You can start, whoever wants to answer which question.
So how would you like to go? Ilavenil, will you tell us how you want us to go ahead? Ilavenil, you're mute.
Uh,
It looks like the questions are, some are very relevant to the current scenario, while some are really general. Uh, I would, I think everyone would like to know the answer to the second question. When does sexuality develop? At what age is one sure of their sexuality? Does it change with time or remain the same? I would like your answers on that.
You would
Yes,
like
Dr.
to start,
Shoiba.
David and Chris. Shall I start?
yeah, please
Go
start.
ahead, sure.
So I often ask people this question as to when sexuality starts, and people say, well, puberty. Some people say at 9, 10. Some people say maybe 4, 5. Your sexuality started the day your father's sperm met your mother's egg. That's when it started, right? Because there's so much of it which is in your genes, and it starts from there. And it's not just about XX and XY, right? We know that our sexual genetic sex, which is XX, XY, and now we know there are so many others. You know, there's X0, there's XXY, there's XYY, and there are mosaics too. And so that's just the genetic part. And then anatomically we are different also. So if you look at, actually, as a gynecologist, I've looked at so many women, and as an MBBS doctor, so many men, and you would find that physically we are so different. And just the same as our entire body is different, our eyes, our nose, our mouth, our hands, our genitals are different too. And they form, like your eyes have a certain, okay, they have a pupil, an iris, and you have an eyeball, and eyelids. The same way, there's a basic template of the human body, but beyond that, it's so varied. It's so varied, right? And each person is unique in their whole body. So the same way, your sexual anatomy, though it follows a certain template, is also unique to you. We do have, and because we started biologically, we had a very binary system of creation, which is male body, female body. And society and religion also supported this a lot, because religion was about creating, procreating more. So it was all about males and females having to meet and produce babies. But we do know that there are almost 1,600 species where there are, same-sex partnerships. And so it's not that human beings are some sort of a different species, that we have emotional, erotic, and intellectual connection with same gender people. Then from the anatomy also, if you want to look at it, we have people who may be typical male, typical female, but we also have people who are intersex, which means when they're born, as a doctor, as a gynecologist, the moment the baby is born, once everybody knows the baby is crying, the first things they say is boy or girl. And in India, you know how crazy we are about this whole boy business and girl business, right? So, is it a boy? Is it a girl? And sometimes the genitals are such that you cannot really make out on examination whether it's a boy or a girl. Now, that is termed medically as intersex. And so, traditionally, doctors would force, because parents would be like, what do you mean? Do I get pink dresses, blue dresses? How can you tell me you don't know what my child is? You have to tell me. And we wouldn't allow people to be individualized. So, they would be just, you have to be a boy or a girl. And so there was some amount of social pressure, and doctors did not resist the pressure, because if you look at doctors, they're very much part of the same society, right? So they can be as bigoted, narrow-minded as anybody else. And so doctors would often do surgeries to force the child into a particular sex, which was terribly harmful, because as the child grows, the child knows pretty much their sexual identity, but we have to wait for the child to tell us. And so there were, anatomically, you have males who may be in very many different shapes and sizes, females in different shapes and sizes, and intersex children who don't fall into a typical anatomical category. As we grow, we now, there are studies which say, earlier they would say puberty, when then 9, 10, and now we know that even at 1, 2, 3 years of age, children are able to express their sexual identity. And it's very often that you imitate the gender of the parent with whom you connect to. Or sometimes children may not want to be a boy or a girl at all. You may be gender neutral, gender fluid, just not wish to be termed a boy or a girl. And that's your sexual identity with developing. And then as you grow forward, one of the reasons all animals are children is that we survive to adulthood, and then we want a companion, a partner. And so for a partner, you are often attracted to somebody, and that's your orientation, to whom you're attracted to. And whom you're attracted to may be anybody, everybody. So you could be, heterosexual, you could be homosexual, you could be pansexual, you could be bisexual. We now have groups who are asexual who say, listen, I'm not sexually attracted to anybody. Is that okay? And why shouldn't it be okay? And I think so, I won't, as I said, so it's at different times. And the problem is, because we don't talk about it much, people find it difficult. Like, as I grew up, I may say I don't like brinjal and I don't like milk, and you may find I'm lactose intolerant. But because we don't talk about sexuality and attractions in the same way as we talk about vegetables and fruits and milk, it's very difficult for me to understand who I am till I start getting to know. And I think one thing children are very lucky in this age is there's lots more exposure and the ability, like, for example, this forum, I don't think this would have been possible, even 10, 20 years ago. I'll stop there.
One of the things that I've experienced over the last decades is that many of the men that I dealt with primarily in my practice, many of them came out as gay because that was the way that they could associate with other people who most thought like they did. But many men realized over the years that they were not actually specifically gay. They were really more gender fluid, and Sometimes they would go through periods of time when they'd be more attracted to women, sometimes more men. And so it's like, I found that it's really very difficult to pigeonhole someone's sexuality as either gay or straight. It's kind of an artificial construct. And most people are really somewhere along that spectrum and not at one end or the other. In terms of how is sexuality connected to health, one of the things that I think about is if a person cannot deal with his or her sexuality, so many people have internalized homophobia, and if you actually don't like yourself, if you don't love yourself, how are you going to take care of yourself physically or mentally? And so I think becoming comfortable with their sexuality and associating with other people who are comfortable with their sexuality. When you associate with people like that, and when you believe and trust in yourself, it's only then that you can take care of yourself physically and emotionally. So I think that physical health starts with good mental health, and that starts with becoming comfortable with who you are.
Totally agree.
That was a wonderful answer from all the panelists, really. Let me ask something else. Okay. These questions.
If there are more
Okay.
questions,
There is one more. It just came, ma'am. What if someone is confused about their orientation? How can they figure out? Before I put it to the panelists, I am going to say something about myself, which I don't usually open up to others. I think this is a forum that is good enough. Okay, let me ask Ritesh. Ritesh, when we met, did I say anything about me being asexual?
No.
No, right? It's never been discussed, I think. I thought I was asexual for a very long time. But when I came out of a lifelong depression, I suddenly stopped being asexual. But the thing is, I went to a psychiatrist just before I came out of depression on my own. I'm rather proud of that. Just before that, when I went to him, the first thing he asked was, maybe there is a reason for this asexuality. Maybe it's trauma, or maybe it's something else. And I got quite angry because he was not accepting me as I am. So I would like to add that also to this question. What if someone is confused about their orientation? How can they figure it out? Is it okay for a professional to step in? Is it not okay? And let me start with, yes, please.
It's interesting about confused is a pejorative word. And so I would like to reframe that to suggest that we create a society where instead of confused, we're encouraged to explore. Mm-hmm. And one of the things that I would see that when my grade 9s would come, heard about the Gay Straight Alliance, at lunchtime, you see them walk back and forth across the door in the hallway. And you know, if they walked past the third time, they wouldn't come in. But you know, we work very hard to create a very safe place in which acceptance is extremely important. And that fluidity is perfectly fine. Exploration is perfectly fine. And that I would see young people coming in, they would have, you know, identify as a female, would have a girlfriend in grade 9, a boyfriend in grade 10, maybe a girlfriend and a boyfriend in grade 11. And so they tended to settle into one orientation by the time they left high school. But they were given the freedom to explore. So in the high schools here, we have gender neutral washrooms. So it's not the boys' washroom, it's not the girls' washroom, it's a gender neutral washroom. And so this is a very clear signal from society that fluidity is perfectly acceptable and should not be framed as a pejorative, that confusion is a pejorative, but as a positive part of the growth of the individual. And I was going to check this before I commented on it, but I believe going forward on Canadian passports, it does not identify whether you're male or female. You know, so these become signals from society that we're not necessarily emotionally, psychologically binary. And when we can reframe things, it becomes a much healthier space in which to explore, develop, and to find where you are in your own space. And that it is perfectly acceptable to move. As you know, as David suggested, there's this pendulum, and it's rarely 100% gay, 100% straight. And it's this pendulum that moves. And then as we get older, we tend to settle into one or the other, or you know, thruples are something that are happening more and more in North American societies, which involve both biological identifying partners.
I find that, and I can't speak about your case in particular, but I find so often the confusion is coming as a result of people feeling a certain sexual attraction, but at the same time, there is so much societal pressure against that. And so that people try so hard not to think in a certain way because they were, well, and let's face it, even in North America today, even though once a person comes out as a gay man, you know, it's a very joyous life. I mean, I met Chris in 1985, and I can't imagine my life being any more beautiful and joyous because of having met him. But being a gay man poses a lot of challenges. I mean, we risk certain infectious diseases. I mean, right now, Chris and I have retired from, we're not living in the city, we're living in the country. And there are like all kinds of churches around here. Chris and I tried to get married here after we've been together for 20 years. We couldn't get a church who would consent to marry us. And so I think a lot of that confusion comes from the fact that when you identify as being gay, life is a lot more challenging. It poses a lot more challenges. It can be very joyous, but it's very challenging. And so I think that a lot of people, because of societal pressure, they try to push back from ways that they're thinking. Whereas if we had, as Chris was suggesting, a society where it really didn't matter if you're attracted to boys or girls or both, or weren't attracted to anyone, that it didn't really matter, I don't think there would be this angst.
I just looked it up, and actually the new Canadian passports say you have the options, 3 options. You can identify as a male, identify as a female, or identify as another gender. And so when society starts to send these very concrete signals to the general population, the cause for confusion, anxiety, depression, rejection, fear of rejection begin to disappear. And it begins with our governments. You know, we live in a society where religion and governments are not allowed to be connected. And that has some very positive things. There's some negative things to it as well. But when the society or the government states very clearly then it sends a clear signal. And then you have the religions, whereas, you know, as you suggested, you know, religions, they promote procreation because it's more people that belong to that religion. So there's lots of religions say that if the parents are belong to this religion, the children must be raised in that religion. And so, you know, it becomes some very key factors have to be reframed in order for people to feel whole about themselves. And that, of course, that affects their health, their mental health, their physical health. And certainly as a yoga teacher, I can see people come in on Friday after a full day of work and they're just fried. You can just feel it. You don't have to talk to them. You can just see it in their bodies. And you spend, you know, I spend all this time getting people centered and relaxed and ready to practice. Yeah, so all of this very much does affect mental and physical health.
See, I see like sexuality. It's like we have a lot of Indian friends who have veg families, and then they'll come to our place and they'll be like non-veg, and it causes a lot of confusion. Like they're eating meat at our place, but they're not allowed to eat meat at their family's place, and they get a lot of family pressure to be veg. And so I find sometimes veg versus non-veg is a little bit, it's so binary, and it's like sexuality too. And you get a lot of pressure to eat in a certain way. You get a lot of pressure to have sex in a certain way. And so.
Oh my God.
Yeah.
There's I have a little anecdote. Every Friday, there was a good friend of mine at work. She was Jewish, from a very Jewish family. We always went out for lunch, and she always ordered the bacon sandwich because she knew she could do it with me. But when we were with her family, it was the full Seder. Everything was just like kosher, blah 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 blah. But she knew she could have bacon. She ate with me.
So that causes a lot of confusion here in Canada, with people trying to integrate into Canadian society where we're most people are non-veg, and then you know live with their own families. So, yeah.
Dr. Shoiba, would you like to add to that, please?
Yeah, I think, you know, when young people tell me they are confused, I say I'm glad. Because if you were very sure about everything by the time you're 14, 15, maybe you may have some shocks ahead of you. I remember when my daughter was 13, I was at the dining table and she came out and she said, "Ma, I think I'm bisexual." I said, "You know, pretty much everybody is, but why do you feel that?" And she said, "I'm not sure." I said, "Is it that you like girls more?" She said, "No, I don't like girls." "Do you like boys? Are you attracted to boys?" She said, "Don't like boys either." I'm like, "Well, rather than bisexual, it seems asexual, don't you think?" And she was like, "Yeah, what's bisexual?" And I was like, you know, something, you're just growing, and just explore and don't label yourself, because, you know, you're going to find out about yourself when you meet different people. And the ultimate thing is, whatever our sexual orientation, we don't get attracted to genitals, do we? We're attracted to a voice, a smell, a sound. We're attracted to how that person makes us feel, to the sparkle in the eyes, to the touch of the skin. That's what we're attracted to. Why do we put a gender onto it? And she was like, okay, I'll think about it. And so that's what I sometimes say, like, confusion is not bad. It's when you say you're confused or I'm confused, it's scary. But I think it's just a place of not knowing enough and not understanding myself. And I think that's really the place to be. And, you know, I've had friends who were in marriages and they were happily married and then unhappily married. They had kids. They were good parents, not so good parents. And then they left the marriages. They got into a different sexual relationship with different people. They realized their orientation had changed, or they had not realized it. And as you know, in India, this whole marriage business is so crazy. You know, you have to get married. Otherwise, your parents are tortured, so you get married because your parents are getting tortured by the rest of the relatives. It's so weird. I've had people who knew they were homosexual, but they were not allowed to not marry, and they tried to push it away by, I need to study my masters and I need to do my MBA, and and then the mother would say, I will commit suicide if you don't get married, because what will people say? And the other thing is, the father has to retire after the kids get married, so I'm going to retire in 2 years. I need you married and settled. So this, as someone had mentioned, this whole context of socio-religious need to get your kids married, as if that settles life, and have them have babies. I, as an obstetrician, I know how many couples come to me who've been married 1 or 2 years, and they're like, you haven't had a baby yet, and they're like, but we don't want to have a baby yet, and they're like, take them to a psychologist, there's something wrong with them, why don't they want to have babies? So this the reproductive part of sexuality is enforced on everybody, but yet sexual exploration is not. And so therefore sexual health becomes such an important part, because if you look at the fact that all of us become adults to live in an intimate relationship, so much of my aims, my goals, my life, my career, my beingness depends on my sexuality and my understanding of it. I may be in a partnership, I may not be. I may be in partnerships with many people. I may have relationships with many people. It's not necessary, it has to be just one person. But if I know myself and understand myself, my ability to be collected and settled, as you had mentioned, Chris, I like the word being settled in oneself, to be able to explore everything else is so important. I mean, so many times you see boys, they're reading books and, chemistry, you sit for 3 hours and all they're seeing is naked women in front of them walking around, and they've sat for 3 hours at the chemistry book. And you say, what did you study? And I'm like, I don't know what I studied, because all I could see was naked women in front of my eyes. That's like, I'm like, go and get that naked woman out of your life, go to the bathroom, do your stuff, come back again, and then read chemistry.
Ilovenil, before you continue, let me add the third panelist to our mix. So let me add spotlight on him. So welcome Dr. Mohan Raju. He's a clinical psychologist in Department of Psychiatry, Ramaya Medical College and Hospitals, Bangalore. He teaches at both undergraduate and postgraduate levels to streams like psychiatry, psychology, medicine, and nursing. He's also a clinical consultant offering services that include psychological testing and psychological therapies, and is part of several research activities at his institution. He has a keen interest in and expertise in issues related to gender, sex, and sexuality, and he has a certification in couple and family therapy. So I am going to let Mohan weigh in, because you have been hearing since the last question. So do you have anything to add, Mohan, before we continue?
I'm very glad to hear how Dr. Sharma puts it. Have fun while you're doing it. Have fun while you're exploring your own self. And it's also about allowing yourself to have that. I think developing some kind of kindness toward your own self while you're exploring that. I'm totally with her.
Okay. Thank you very much, Dr. Mohan Raju, and welcome to the panel.
Thank you.
Okay, for the next question, what I'm going to do is combine a bunch of these questions because many of them are closely related. The health needs of people from the LGBTA community. What are they? And when people are asking, does sexual health affect me? I think that's a yes or no question. I mean, it's a part of them, so why won't it? I think I would like to hear from all of you, especially for the LGBTQIA plus community, mental, physical, emotional, and sexual health. What are their needs and how do they address it, especially in the pandemic? Let's start with Dr. Mohan Raju this time.
Right. So there are some similarities and some uniquenesses when it comes to health needs of the community in during the pandemic or outside of it. There are some people who come to us for help. People uh, uh, they could be coming to you for different treatments. They could be coming to you for any kind of anxiety, depression, other mental health issues that most other people go through. And there may be very specifically related to their own gender identities, their own gender expressions, or sexual orientation, or issues to do with coming out, or it could be also about sex reassignment procedures that come to us with. So there are some similarities with which the rest of the population, the cishet population, comes to you with, and there are some unique needs of this community. During the pandemic, yes, there are some special concerns that people from the queer community experience. It could be to do with the sense of isolation they experience if they are staying away from family, if they are, or if they are staying with family that is not accepting of their gender identity or sexual orientation. So these concerns become important, and even very basic needs like the finances, the loss of employment. This has impacted the community in a big way, especially in Bangalore. The transgender community is mostly employed in sex work and begging. So they are severely impacted during the pandemic because of loss of opportunities to earn a living. So that also has a significant impact on the mental health of people, uh, resulting in increased substance use, could be alcohol or other substances, leading to depression, anxiety, fear about future, having lost loved ones to COVID. So all this comprise and give rise to some that are very common among the cishet population, some that are very, very unique to the LGBT population. Uh, Children who live with family that are not accepting of their gender identity, having to pretend to be straight, pretend to be of a certain gender, again experience a significant distress living with families. Uh, Having to dress in a certain way, having to speak, having to sit in a certain posture, that also can have a terrible impact on the emotional health of individuals, and having no access to gender affirmative people, perhaps in the form of support groups, or otherwise in public life, not being able to go to a cafe that is gender friendly, having no access to such avenues, also is impacting people with diverse uh, sexual identities and gender identities. Do I go on?
You can go
I'm
on. Yes.
Yes, you can go on, sir. I'm having some network issues here. I'm just trying to rectify them. I would like to hear Dr. Shobha's answer on the question next.
What I think is one of the things when we are looking at feeling lonely, you will be amazed that since I work as a gynecologist, so I work with a lot of women who are cis het, apparently, married, kids, they are matriarchs in their family, their life is, taking care of the house, and they seem to be successful human beings. They married according to their religion, to the person their parents told them to. They had kids accordingly, and they're a perfect part of society. And they are deeply unhappy, unfulfilled, sad. They're almost suicidal. And the point is, it's not necessarily that you only have to be from the LGBT community to feel sad and lonely. There are people in a huge family who are lonely because they say nobody understands me. So this mother's there, she works, she cooks, she has no communication with her husband. Her children are grown up, they leave home, they've gone abroad. And she's like, what did I achieve in life? What have I done? What did I get? Is there anything worth it? Who am I? And this question of who am I comes to everybody. And it doesn't, when you have family, it helps. When you have friends, it helps. But I have to be a family to somebody for them to be family to me. I have to be a friend to people. If I sit alone, it's difficult. Definitely for people with alternate sexualities, with a different sexuality, especially if you haven't come out at home and if you don't have family support, it is deeply distressing. But even for the third daughter, and I'm talking in the Indian context, a third or a fourth daughter, that son who didn't happen, how do they feel? Traumatized. They feel unwanted. They feel they have no value. You have children, and it's not just sexuality. The way as parents in India, my child has to have 90%. How can every child come first? But you're hopeless if you don't do well in mathematics, or you can't answer and you don't have straight A's and all your stuff. How much trauma is created by these expectations? So expectations are not just about your sexual being or your behavior, as you mentioned, how you sit, how you stand, how you walk, how you talk. Parents upbraid children. Why did you behave like this? Don't you have better sense? And they tear children apart in front of others. It's a question of self esteem. Your sexual health is one part physically. How many children I know you're told you're so fat, don't eat so much, don't eat so much. Or, you don't have, you don't know how to talk. Or you're so dark. I mean, dark is another big issue in India. So your gender, your color, all these things, there's so many things which impact you. And then beyond that, if your sexual understanding of yourself is confused, it's traumatic. It's traumatic. So I think it's important to be a friend, to get friends. And I think in terms of, we always start looking for a partner. Sometimes I think it's not just my partner in life who was a person who created in me a sense of comfort, but also all the other friends I have. And to understand that my emotional well-being doesn't depend just on one person, it's many, many people. A grandmother who loves me, with whom I have a great relationship, an aunt or an uncle, a cousin, a niece, a friend. Um, there are so many, many human beings in our lives with whom we can get relationships which are rewarding and give me a sense um, of satisfaction of being something, some value of value. I'll stop there.
Before I call Dr. David, I just have to say that I'm the third daughter. And the earliest memory that I have, earliest, I'm saying, is everybody who saw me asking, is the third also a girl? Even though my parents were absolutely against wanting a boy or being disappointed in me or anything. That's the earliest memory I have. And now I'm not married. So now everyone is saying she's sad. I'm not sad. I'm probably the happiest I've been in my life right now. But apparently I'm sad to the whole of society. And this, what ma'am was talking about getting married to something, somebody or something. I mean, the first was a Freudian slip. It's like, get married. It does not matter what you get married to, just get married. Something that, yes, something that keeps on coming is, why don't you marry Ritesh? Why? He doesn't want to. I don't want to. So why? You're talking to him, right? Yeah, I'm talking to him. Yes. So I'll just put all that there, and I'll ask Dr. David and Chris to give your opinions.
Now, I got to remember the question. I think the question was, what are the health needs of gay people? Was that the question?
Of everyone in the community.
And
That was the question.
no, I can speak about my experience. So, and that's gay men. The needs of there is the mental health problems that I used to see in my practice. It was a large part of what I dealt with, in particular depression. And this was in the context of a family practice. So depression was, managing depression was a huge part of my practice. Another a really emerging, very serious problem in Toronto was substance abuse and some really nasty drugs. In particular, I don't know if it's a problem in India. Is crystal meth a problem in India right now? Crystal meth?
Not really, no.
Okay, but crystal meth is like, 30 years ago, people would have, be a little bit of marijuana, a little bit of this and that. But I would say in the last 10, 15 years, a lot of sort of regular guys, middle-class guys, started getting into this crystal meth, which completely destroyed their brains. So much of it comes from, I think, internalized homophobia, and a lot of men can't seem to have sex unless they're high. I think because there's the, they don't really like who they are. When they're high, they can kind of escape that. But so many guys destroyed themselves physically and mentally because of substance abuse. So substance abuse was a giant problem at the time that I was retiring, particularly crystal meth. We had a psychologist, and basically all that she did was deal with people who had substance abuse problems. That was her full-time job, dealing with substance abuse, and even with with a clinic of 12 doctors and a psychologist, we could have had 5 of them to deal with the substance abuse problems that we had to deal with. The other thing, of course, is infectious diseases, and HIV was becoming less and less of a problem, but we still had a lot of problems with hepatitis C, syphilis, gonorrhea, chlamydia, human papillomavirus, and we have a lot of ways to prevent these infections, and we have vaccines for a lot of these infections, but and methods of treatment. But unless people are willing to be open about their sexuality, to get tested, the problem just gets worse and worse. So yeah, painting a bit of a gloomy picture, I guess.
I guess it's a little.
Time. Sorry?
I was just going to add something. It gets a little more complicated in the context of people who are in the closet, who may not be willing to access any help also, even medical advice, may not be in a position to access even something as basic as a condom because of the shame, guilt associated with their own sexual identity, sexual orientation. So they may engage in unsafe practices. If you want to look at infectious diseases, even like you rightly point out, using substance use as a way to kind of work around their sexual needs. In Bangalore, in the last few years, MDMA has become a popular drug in the party circuit. So people use this to feel closeness or all sorts of different feelings. Not crystal meth essentially, but again, these kind of drugs do get very popular in the queer circles. You need some kind of defenses to deal with the negative emotions associated with gender identity and sexual orientation.
I think you bring up an important point that when people are not out of the closet, they can potentially put themselves at risk, but also the people around them. This is something that we fought very hard for in Toronto about 30 years ago, which was anonymous HIV testing. Now we battled with our public health department because they were saying, we want the names of people who are HIV positive so that we can counsel their partners. And what we were saying is, okay, if you've got a married man married to a woman who's having sex outside his relationship, but if that man thinks if he gets an HIV test and if it's positive, and if public health is going to be knocking at all the doors, he will not get tested. And so we fought very, very hard to get anonymous HIV testing because of that very thing, so that people could safely get tested and then work with their doctors to talk with their partner for that sort of thing. So I think that's very key what you say. Yeah. So we don't have anonymous testing anymore. We have what we call non-nominal testing. So we don't use a person's name, but we still give information to public health for their studies in terms of demographics and that sort of thing, where they live, their risk group, and so that public health can study the pandemic. But generally, at least in the group that I used and other doctors in Toronto, we didn't use people's names for HIV testing.
Actually, we did have that in India. When HIV first started off, and there was all the stigmatization around it and a lot of trauma. Then, since I think the 2000 plus, they've started having. We had the National AIDS Control Organization, so we have VCTCs, that is the voluntary counseling and testing centers, where you could go if you had a doubt that you had HIV. You could go, and they wouldn't take your name. They would just do the blood test and counsel you testing, counseling, and post testing counseling. They did have that. Somewhere HIV has now become more mundane and it is settled in. I have so many young couples who are HIV positive who come in for having a baby and things like that. And it's as much a normal person as everybody else. But I think one of the issues is access to health is when you're not able to speak about who you are. And I think that's very uncomfortable, as you said, whether it's MSM. And again, actually, it was very interesting. I was reading an article on gender bias in the homosexual world or alternate, because a transgender male to female has a better chance of being heard and having a group than a female to male. Uh, Lesbians are somewhere lost in their needs and requirements as compared to male homosexuals, because again there is the genderedness of even within the LGBT community, where men are able to make groups or make themselves heard as compared to women. And there too there is isolation of women, where many of my patients who don't subscribe to being cis het have not understood where to go to get help. And I'm sorry to say that doctors, gynecologists particularly, are extremely unknowing. I would like to say, I'll be kind and say they are not knowing and ignorant about it. In fact, I think all of you must be aware of the Madras High Court judgment, which was so wonderful, because when the case came up in front of the judge about whether conversion therapy should be used on homosexuals, he said, I don't know about it and I need to be educated. And he went through education sessions, and he came back and he said, I have understood, and I think you cannot allow conversion therapy on anybody who says they're gay. And that's such a wonderful judgment.
Hmm.
Right. And in terms of health, I would talk of the transgender community, where people have asked me, do transgender people, can they access health? And I said, they're not even allowed to come in through the front door. What you're talking about access health? You're telling me you want to get to the doctor, you have to pass the security guard who's like, get out from here, because people are worried that they won't have an OPD. Other patients in their OPD will get upset if there are people who do not look normal. So forget access, they can't even get in through the front door of the hospital. So very often they would go to quacks, and there they would end up with a lot of medication given, which is very harmful and quackery, literally. So I think the access to health is just getting to a doctor before you get to a doctor who understands what your health problems could be.
Thank you. Our moderator is facing internet issues, so I'm taking over. She is back, but I am not sure whether she has a stable net connection to continue. Before we begin, for all the audience here, you can ask your questions. We are still answering those anonymous questions that we received, and that does not mean that we will not ask and answer your questions. Okay, so if you have any kind of question, you can put it either to me or in the chat, okay, directly, and that is how we'll continue. Since you talked about gendered issues related to health, Dr. Shoiba, I have to ask the seventh question, because I was waiting when that question would come. Should women discuss their health needs in front of men? I don't think I could replace women with any other term and it would still be relevant, while the latter are so ignorant about the body and the health issues. And we started with that same premise, right? The people are so ignorant about their own body and what affects their health in totality. How can they even be aware of someone else's needs, if it's especially across the gender and sexuality spectrum?
Yeah.
And how do we even begin the
Right.
discussion? I love that question. I think I like that part of the question better than even the first. How do you even begin the discussion?
So Well, when we first started, so I must say that when I started as a sexuality educator, we were all gung ho to talk about sex and reproductive health in schools. And because we were under the guise of doctors, I must say that as guise of doctors and not activists, we were allowed into the front door. And the first time we took a class, we wanted to take it for boys and girls together. This was in class 8. And when we started talking about the development of the body and hair growing on the body and body odor and, acne and pimples and feelings, there was a stunned silence in the class. And this was in about 99, 98. And all the children were staring. Either they were looking down at their books or they were looking out of the window, but they were not looking at each other and they weren't looking at us. And so at the end of the class, 45 minutes, we said, any questions? And they were just looking at us like, deer caught in the headlights. Like, are you mad? I don't know what the hell you're talking about. We're not talking about this. So, we went, and my friend Sangeeta and I, who started Enfold, we were like, what do we do? How do we talk about this? So then we said, okay, let's keep boys and girls separately. So in the beginning, we would divide the classroom, boys and girls separately, and talk to them. And this was from class 8, 9, 10. And then we found that boys were willing to talk and girls were also willing to talk. But we also felt it very important that after the boys understood about their own body and, development and puberty and masturbation and everything, and girls understood about their lives and their, periods and attractions and masturbation, we wanted the boys and girls to understand about each other. And I remember Sangeeta was taking the girls in that session. So we divided the class. She was talking to the girls, I was talking to the boys. And that day I talked to the boys and said, I'm going to talk about the girl's body. And they looked at me and like, why? So I said, well, for example, I had a patient who came, she was 45. She came, she was collapsed. She collapsed at home. So she was in the kitchen. She suddenly fell down, crashed. So her husband, who was in the house, rushed, picked her up, and then he called his son, who was at work, and they rushed her to hospital. She had a hemoglobin of 4 grams, and she was really anemic. She could have collapsed anytime. And when I asked her, she said, no, my periods have been very heavy for the last 2 years. But I have 2 sons and my husband, and I didn't know whom to talk to. I felt embarrassed to tell them. So I asked the boys, I said, is it important that your mother can talk to you about things like this? Is it important that your wife can speak to you about this? So, this was class 8 boys. They were like, wives and things are different. Girlfriends, never had them, don't know what they mean. And they were like, we wouldn't talk about our mother. So I said, what are periods to you? And they would say, oh, my mother doesn't go into the puja room. She doesn't read the Quran. She doesn't touch the Guru Granth Sahib. And so there was all these religious things around the period, but no understanding of what it was. And when we talked to them about it and they understood, they were very uncomfortable. The boys were really uncomfortable, but we wanted to talk to them. And then when the class got over and the boys were walking out with their heads spinning with uterus and ovaries and periods and whisper, and suddenly they said, is that other ma'am talking to the girls about the boys, about us? I said, yes. We're talking about, erection and masturbation. We're talking to them about that. They need to understand you. And the boys were like, oh my God, shit, 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 shit. They couldn't believe, that the girls would be talked about these things. So I think it's essential. And it starts in school. I think it starts in school that we talk about both. Shouldn't say both now, not the binary. We talk about reproduction. We talk about the puberty. We talk about sexual orientation and identity from a young age. And I think it's also important in homes. And I see certain homes where my son will go out. If my daughter started her periods, she'll tell her, my son, please go and buy pads for me. I'm running out of pads and I'm stuck in the bathroom. I can't go out. And for, in the family to speak about things like that, for mothers to be speaking about periods and to say, and I think that's where women have to break the barrier first. Women have to, like so many times women, couples talk to me. So a mother will say, I can talk to my daughter about, periods, but how do I talk to my son about erection and sex? Shouldn't my husband speak about it? So even this gendered idea that only men should be speak to boys, to their sons, and mothers should speak to their daughters. So breaking that, how do we break that? By educating parents. Yeah.
So, Chris, do you have anything to add here?
Regarding just going back a little bit, about mental health. and the LGBTQ community. I think any individual who covers up who they are is expending an extraordinary amount of energy doing that. Energy that takes away from their capacity to socialize, to be engaged, and whether that is socially or academically, and so yes, I do agree that the LGBTQA community is it is very important that we can break down that need to cover up who you are, because it does lead. It takes an extraordinary amount of time and energy, and I would see that with students who, when they finally came out of the closet and celebrated that, everything about them changed. And it was simply because they weren't wasting so much of their precious energy covering up who they are. So I think that is certainly a very important thing to recognize. And because if they don't, it's the depression, the suicide. But for young people, and I think and it's very even more pronounced in India, where the family unit is so central, that the risk associated with coming out is extraordinary. I mentioned earlier on, I was invited to teach men's yoga in Bangalore, Mysore, and Goa 2 years ago. And what I found were a lot of married men who were interested in other men. And these were pretending to be cis het men. They were forced, and these are their words, into heterosexual marriages. I'm still in contact with an awful lot of these people today, and people who I know who are clearly, firmly homosexual in their own mind cannot break free of the need to marry a woman. And it's simply often financially. They're so dependent upon the family. And these are grown men in their mid-late 20s, 30s, who, as you've mentioned, they've gone through, they've got more PhDs than they know what to do with, but it was a way of staving off the marriage. With the younger people that I worked with, they financially depended upon their parents. And so one of the things that we did provide is a safe place that the young person could go to that day if things didn't go well at home. But the amount of time and energy and the consequence to their academic world was huge because they spent so much time covering up. I think that those individuals who are biologically female are doubly repressed. They are dealing with the female issue in a society that is still very much male dominated, even though there are the laws for equality, but you have that piece. And then you have the sexual orientation and the expectations around that. And so what I would see, again, this is purely anecdotal, is that young women who were lesbians suffered a great deal more. And because there was, they in their mind saw two strikes against them. They were women and they were lesbian. And to spend so much time and energy covering up who they were, there was nothing left over for anything else.
Wow. Since there has been a lot of issues about, we have been able to show that covering up your sexuality or your identity has so many consequences: physical, mental, emotional. There's a price to pay, literally. There's a question related to it. So how then you start identifying our orientation? Whom should we talk to, to get clarity? Uh, if the friends and family in the area or in the city you live in are narrow-minded, orthodox, are a bit judgy, where do you start seeking that help, trying to figure out who they are?
Do I go?
Yes.
Yeah, I think Siddhant asked this. One thing is, of course, our socialization has always been into gender binaries. Uh, because the society is very, very gender binary, it is possible that people who do not identify with these binaries may experience discomfort while growing up. And you may have confusions, like Pam was earlier saying, confusion is a good thing. Nothing is certain in our life. Anything for that matter is not certain. So accepting that I have some uncertainties about my own gender, my sexual orientation, is a perfectly good way to start exploring yourself. There is no one person that can help you understand what your gender is. It's your own journey. And what I would recommend is start this journey not with some destination in mind. Start with this journey thinking that there could be many destinations that can happen. So this whole idea of I need to figure whether I'm a transgender or not, I need to know whether I'm gay or not, that itself is very limiting in nature. So there are different expressions, there are different identities out there. A part of it may apply to you at some point in time. To understand that the fluidity of gender identity, the fluidity of sexual orientation is important. uh, Being attracted to a particular, if you are assigned male at birth, and if you start feeling attracted to a man when you're in your teenage years, does not necessarily determine your gay. It could be anything, it could be anywhere on the spectrum. To begin with, go with the idea that gender and sexual orientation are on the spectrum, and we all can exist anywhere. If you don't feel comfortable with the current labels that already exist, you can always make your own label that may better define you. Start with identifying people around you that you feel safest with. Could be family, could be friends, could be teachers, could be anybody, or employees, colleagues, whoever that are. Start exploring your own social parts of the gender, which include the names, the pronouns. If you see if that feels okay, a certain pronoun feels okay, a certain name feels okay for you, if a certain way of wearing clothes feels okay, a certain way of walking, certain way of grooming your own self, explore this in this journey without limiting yourself. That no, now I've explored. This is the end of it. There is no one destination to reach. We all can keep exploring. Uh, there is no destination as such here. So start with this. Generally, psychologists may be a good place to start exploring this. They may help you explore yourself better, but doesn't have to be the case. If you do not have any person who is working in that area, see if there are support groups available, if there are fellow uh, gender diverse people, explore with them, especially now with Facebook, WhatsApp, and other social media. It's Instagram. There are groups available. You can talk to them about how their journeys have been, how they have explored their own gender identities. That can give you some perspectives about how to go about. Once this social gender exploration you've been comfortable with, then perhaps you can think about if there are any medical interventions that are required at all for you to feel most comfortable with your own, with what you feel is okay. So going beyond this gender binaries is very important. uh, there may be, even when it comes to trans people, again, can be, some of them can be binaries. So remembering that we don't have to stick to the binaries is most important. So that is
I,
how one can explore one's gender or sexual orientation. That's how I
I,
understand it.
I can remember a
Thank you,
funny
sir.
story from
Thank you.
way back to the 1980s. Um, I can remember that a young patient of mine came out to his father as gay, and his father said, "I need you to see your family doctor, and your doctor needs to refer you to a psychiatrist." And so I said to my patient, "Tell your father that your family doctor is gay, and all the psychiatrists that he prefers people to are gay. Just make sure that's okay with him, and I'll make that referral."
Okay.
I think his father calmed down.
So
Yeah,
I
yes, ma'am.
I
Please go
had
ahead.
two different experiences with people. One was this young man who came into my OPD and he said, I'm a little confused because he was in the IT profession and he'd stayed in San Francisco for 3 months on work. And at that time, one of his roommates, who was also from India, involved him. He caught him watching homosexual porn, and when he liked looking at it, that guy sort of involved him in homosexual activity. And while he first said, no, I don't want to do this and all, he was quite comfortable, but he had no further interest in it. And when they came back, they didn't continue the relationship. He came back, and then he came to me about a year later saying, I'm very confused, my parents are planning on my marriage, and is it that I'm homosexual, and will I be able to, be able to get married? Should I marry? Is something wrong with me? So one of the things was to explain that most of us are bisexual. So there is this fluidity and that we change with things. And there is something like a temporary homosexuality also, where, you have sexual feelings and the only person who's there would use you. I think that's one of the questions which have come up. But I also asked him, I said, when you fantasize, I mean, what do you fantasize about? Men, women, others? And he said, women. I get attracted to women. I'm interested in having sex with women. I fantasize about that. So I said, well, then, whatever your orientation, you may be bisexual, but you do see more, towards heterosexual. So if you do fantasize about women and comfortable at the idea of having an intimate relationship with women or physical relationships with women, I don't think you should have a problem getting married to a woman. But to also understand that if you were homosexual and you were uncomfortable having sex with a woman, because having sex is just an act. And the reason why so many people who are homosexual are married and have kids and may not realize till they're 30, 40, 50, 60 that they were not really satisfied sexually, is because society pushes you towards a heterosexual cis het relationship. And the pressure is so strong that if you're bisexual, you're not really going to push it. And even if you're homosexual, you may end up, just as somebody said, just the pressures of having to tell your parents and coming out to everybody, and in your own sense of homophobia, that there's something wrong with me, where you don't explore it and you just, have a very unhappy sexual life. And you're just a good father. You can be a good father, there's nothing wrong with that. You can be a good husband, a good child, good great grandfather, and somewhere in yourself there's a little hole or a very big hole which was never filled. The other thing also is that there was this young man who came, and another one was where we had taken classes in for 11th and 12th in a Christian college, boys college, and we had two sessions. They loved the sessions, and then we had the third one, which was just question answers, and there were all sorts of questions. And because it was a Christian college, we did not talk about homosexuality while we were talking, but it came up in the questions, and students themselves answered. As when we said, what do you feel, they said, yeah, it's fine, it's normal. Anybody, if a person is homosexual, that's who they are, and we shouldn't be negative towards them or disrespectful. So anyway, we had a great feedback from the school and the classes and all the rest of it. And the next year, when we went back to take these sessions, the lady who was in charge, the English teacher, I remember, the professor who was in charge of these classes, said, I'm sorry, we can't have these classes. So we said, why? But, we got good feedback. The students said they liked it. They wanted to have it again. And no, you people advocate homosexuality. And we're like, advocate homosexuality? Where did we do that? She said, no, you were saying, homosexuals are, it's normal to be homosexual. So we said, well, it is. And she said, yes, exactly. That's what I'm saying. You're saying it's okay. Now all of them will become homosexual. And I'm like, okay, I need to shoot. And so that unfortunately is the problem, that when you tell people or students that you're working with students and you're saying that homosexuality is a way of being, a lot of people from the traditional mindset. And then when I asked her, I said, why do you feel this? She said, do you know, I have a long from friend from school. He got married, she has 3 children. And suddenly at 45, she's just gone off, left her husband and children and got off with this girl. And she says she's lesbian. So, I realized that there were so many other, so we have to look at so many other dynamics in processes for being able to come out and talk about these things. So these were two experiences I had. And the other thing which somebody has mentioned about homosexual and heteroromantic and homosexualism is that one of the biggest issues I see, because I also work in the area of child sexual abuse, is that children who are confused about their orientation have a much higher risk of getting abused and the chance of getting sexually abused, because they go online asking questions, they look for groups which may give them answers, and they can be trapped by perpetrators who are surfing the net and looking for children who are abused. So I think it's so important just for the safety of the child. And when we talk to schools and parents, we're saying, when you talk about sexual orientation, when you talk about sexuality, you're protecting your child. You're actually preventing or reducing the risk of getting sexually abused, of being abused by people who, because you don't know who you are or you think you have no place in your family, you allow yourself to be used for the sake of some sense of that somebody acknowledges who you are, but you're being used. And the importance of consent, of respect, of being able to consent to a relationship, that's so important.
I agree with you in using fantasies in exploring one's sexual orientation, but sometimes fantasies by themselves may not always help, given that we are socialized into a very heterosexual way of experiencing pleasure. It's quite possible for people to force themselves to fantasize with the opposite sex partners. So it's important, and especially when people are coming to us with thoughts about partnerships or relationships, I would ask them to look at more than the sexual component that is there. Like you mentioned, just because two are partners, it's not they're always having sex. There are other emotional, social components attached to partnership or a relationship. Have they considered these parts? So I also try and explore the dreams that they have along with fantasies, because dreams are mostly involuntary. So what kind of, do they have sexual dreams? What kind of sexual dreams do they have? What is the partner doing? What is the patient doing in those dreams? What do they look like? So all this will give me clues. But again, I don't want to, because I've had some kind of fantasies or some kind of dreams, that does not again put me in a bracket. Even if somebody were to be bisexual, again, uh, that somebody in the chat window has, which I call as biphobic statement, has said that bisexual people use homosexuals as toys to satiate their sexual desires. So bisexual people are people with the same kind of emotions, desires as anyone else. Because of all the negative socialization that happens around homosexuality, it's quite possible that the visibility of bisexual people gets limited. And there may be some unpleasant experiences people may have had with bisexual people, but bisexuality does not give a license to anybody to use anybody as a toy, or uh, uh, not all bisexual people end up playing the straight card also. So um, I think again I would look at as a journey in exploring oneself, even if one is bisexual. Doesn't, especially bisexual men, does not give anybody a ticket to get married, get into a heterosexual relationship. It's about looking at what they want in this relationship, how they see themselves, maybe a year down the lane, 5 years down the lane, 10 years down the lane, for them to see the different aspects that are there to relationships in general.
I want to bring note to a comment made by Dr. Michael. He works with schools. He works in schools with me. We both work in ESL training, And he mentions that open communications about body functions and sexuality doesn't take place in families because adults don't want these responsibilities. They would rather shift the authority to education institutions simply by paying tuitions. And teachers are assumed to have loco parentis duties. They are supposed to be second parent. And this is something I have faced while working with schools myself, and not just with sex ed, but with a lot of other issues as well. Uh, so this is the situation. How do we begin the dialogue? Because there's another question that is similar. Like another of our audience has asked, like, how do we begin to talk about queer people to schools? How do we bring the positive aspects of it in conversations? And if having this difficult conversations not happening in the homes and in the schools, our experience is almost same as what Dr. Shoiba faced. How do we start? And this is for each of you.
I think one of the things, somebody who was in education for many years, I think that for consistency of informed discussions, the school is a good place to start. If you have a education system that allows for uniformity in curriculum documentation, then it becomes integrated into whether the phys ed classes, the guidance classes. And so one of the key things is informed discussions. And if you rely on parents for that discussion, it's just a reiteration of what they were taught, what they were learned. And sometimes this is really good. Sometimes it's very much based in very prescribed religious views, points of view. So I think the school is a good place. We have a centralized curriculum system here in Ontario, where all schools are required to teach X number of courses and the content of these courses. And so it is built in, right, starting in very young grades, grade 4, grade 5s, that there's small units of study that start to look at anatomy, start to look at age-appropriate sexual health, and that it becomes integrated at a young age. So it's not this taboo thing that exists somewhere else. And it's a little bit like, drinking may not be an issue in India, but certainly in Canada, it can be. And where you see the non-drinking problems are from families that drink at home responsible. And so we have the farm next to us. They have 4 boys. The oldest is 19. All those boys have had something to drink, a glass of wine with some ginger ale in it, from a young age. And so there's no longer this taboo about it, and there's no longer the desire to go out and get drunk and then drive. I think with sexual health, and we're not just talking solely about the LGBT, but sexual health in general, that it needs to be introduced at an age-appropriate content at a young age. And that as the students progress through their educational system, they become more and more aware of more sophisticated concepts and ideas. And that way you have a curriculum that has been put together, peer reviewed, ensured that it adheres to modern scientific data, and that the correct information is being passed on. And that's something that, again, this is somebody that was involved in education for many decades, that I see this as a very important step in education.
I have a related question, and I have faced it while dealing with schools. In the more urban areas, that is the talk on sexual health or health, even mental and emotional health, is more open. But as you go to the semi-rural areas, semi-urban areas, and when you go to villages, there's not even a talk of this. You are supposed to man it up. You're supposed to do. They conform more to the more traditional ideas that is imposed. So how do you even implement, or how do you start this awareness in those areas, small towns, villages, especially?
Do you have a centralized teacher training program?
No.
Okay, so yeah, and that again, when you have a centralized education system for teacher training, um, that's you start your teachers who go to these rural communities are coming from a base firmly, with a strong awareness, and in the systems here, it comes through phys ed classes. That's which then are at younger ages are gender specific, and it's not until more senior grades that you get um, uh, mixed gender classes for phys ed classes. And a big part of those phys ed classes is health, mental, social, sexual health. And that is all coming from a prescribed curriculum, which has not been easy to do. It's not easy at all. And we get governments that come in that don't feel comfortable with them, pull it out, and then the next government puts it back in. But the teacher training, it is inculcated in that particular form. So what goes out to any community, whether it's an urban or rural community, all come from the same base.
Okay. Uh, yeah. I have a connected question. I want to also ask Dr. Shoiba and Mohan also to weigh in. What do you see is the solution for the small towns and villages?
So I've taken sessions in North Karnataka and Koppal and things like that, small places. But I remember then in 98, 99, when we wanted to just talk about reproductive health and contraception, the advent of HIV was very useful because in the fright of HIV, they allowed people to walk in with reproductive health classes, which was not there earlier. And now with the sort of reporting that's happening on child sexual abuse and understanding, the Nirbhaya case and all that, under the guise of personal safety, we are managing to bring in sexual health, you know, and talking about that. So these are ways we can do it. And as you had mentioned, Chris, it so much depends on the government. Unfortunately, education is a state subject, as in the sense that each state of its own has their own, procedures. The central government in India had an adolescent education program, which was pretty intensive and good, but it was only in central government schools like central schools, Kendriya Vidyalayas and all. Whereas the state ones depended. Now, we have to understand that both our bureaucracy and our politicians come from extremely, from the society which is both patriarchal as well as very insular. And so for them to talk about sessions like this is very, very difficult. Once in a while, you get a bureaucrat who's head of, Secretary of Education, who's like really believes that this education will help, sets up the program, they get posted out, and then the whole program collapses. And unfortunately, sexual health is still looked at, contraception, prevention, we don't even talk about abortions. They're not allowed to talk about abortions and pregnancy. The fact that India has one of the highest levels of child marriage, teenage pregnancies are not spoken about. And you were talking about alcohol and drugs. We do have that as a major issue in cities, and a lot of pregnancies do arise from alcohol. There's even the other issue that's coming up, that for a lot of college students and young IT professionals, or just, corporate professionals, where drinking has become a part of the team building activities. There are both women and some men who have faced sexual assault and the shame and guilt prevents them from talking about it. I've had a girl who had come reported rape because she was drinking and she couldn't go home to her parents because they didn't know she drank. So she went to stay in a friend's house, and one of the other people in the friend's house raped her. And she couldn't speak about it because how would she tell her parents, first of all, that she was drinking? So there are so many other levels which we need to look at. In rural India, we have to talk about it. I want to talk about one group of youth from Delhi who in Himachal Pradesh just wanted to find out whether condoms were available to young people, and they just did a little bit of a study over there talking about sexual health. And some panchayat leaders put a case against them saying they're corrupting the youth because they're trying to ask youth whether they've had sex, and our youth don't have sex before marriage, and they went into jail. And it took a long time for them to get bail and get out just because they said they're talking to youth about sex. So they are corrupting the youth. And all of you have heard about our famous politician saying that if you give mobile phones to girls, it makes them lose characters.
It's interesting talking about the mobile phones. I can remember Chris and I were on a trip in the Middle East many years ago, and there was a young couple on a bus, a young man and a young woman, and we talked to them on this bus ride for quite some time, and we were really enjoying their company. And we said, we'll take you out for lunch. So we went out for lunch with this young couple.
And the girls and the child.
And then the girl had a chaperone with her as well, a girlfriend with her. And at one point during the lunch, the boyfriend took his girlfriend's phone, and I said, "What's he doing?" And he said, "Oh, she doesn't trust me. He doesn't trust me. He's checking my call history." And I said, "Oh, really?" And I said, "Oh, well, you should check his call history." And so her girlfriend said, "Yeah, you should check his call history." So the two girls grabbed his phone and started looking at his phone. And he was dumbfounded that his girlfriend would actually consider looking at his call history, but he felt completely comfortable looking at her phone. So I think we did a little something for women's rights in the Middle East 20 years ago.
It was in Jordan.
One of the things that I wanted to bring up about small towns is now Chris and I, we spent most of our lives in a large city, and now we're living in a deeply religious small community with lots of churches around. And there have been many instances when young people, when they come out to their parents, they've been kicked out of the house, and they have to go to group homes or something like that. And the thing that I've come to understand in these small communities is when you have a deeply religious family, when their son or daughter comes out of the closet, these people make the choice, rightly or wrongly, to reject their son because their entire social network is dependent on them following a certain path. And so it's very difficult for the children, but I've certainly come to realize how difficult it is for the parents who have a gay child, who, if they support that gay child, risk losing absolutely everything in their tiny community. They have no friends. They can be rejected by their siblings. They're rejected by their church. And so I think the change, it's not going to happen right away through education. It's going to happen through, like Chris and me coming out of the closet, and we're living in our community. We're integrated in our community. Our next door neighbors are elders in a church. And they, I like to sing part-time, and they invited me to sing for one of their Christmas services, and they introduced Chris to the congregation. And so these are church elders who are introducing a gay couple to their congregation. And so I think that the change starts to happen as more and more people are coming out of the closet and are becoming more comfortable with themselves and are more willing to take that risk. So, yeah.
Something I used to say to my students is that, how long has it taken you to come out of the closet? 14, 15, 16 years. Don't expect your parents to accept you overnight. It took you a while. You come out of the closet, be prepared. They're going to go in the closet.
This is what we always used to say. You come out of the closet, your parents go in. And
so you need to cut them some slack that they need to get used to this. And
So-
you know how difficult it was for you. Well, what they have, this is their future life, is their sons and daughters. And it's sometimes they're aware and they often say, well, what took you so long to come out? But you get parents who go firmly in the closet and they slam that door. And that door includes changing the locks in the house and you're out. And so as educators, there was a mechanisms in place with Children's Aid to ensure there was a safe place for somebody who got kicked out of the house to go. But it's not an easy process, and it's not a fast process. You're coming out, you want to put your dancing heels on, but the parents are going to go in, and then they have to deal with their siblings and their parents and all the rest of it.
Dr. Mohan, you want to weigh in on this?
About introducing sex education in rural
Yeah.
areas. So
Yes.
we can use this Madras High Court judgment itself as a precedent. In the judgment, the judge Anand Venkatesh also speaks about making recommendations to the concerned ministry of imparting awareness programs. So perhaps we can use these kind of precedents set by some courts to make this part of the curriculum. If a Ministry of Health and Family Welfare or Ministry of Education can be kind of forced taking this judgment to introduce sex education, along with the sex education, talking about reproductive health, talking about gender identity, sexual orientation can happen. And I also believe that gynecologists, obstetricians, pediatricians perhaps can be more impactful in rural areas when you have new parents coming into their clinics, talking to them about parenting, talking to them about what is what about gender. So they can also play a big role in educating new parents about these aspects.
Can I mention a slightly positive story? So there was this young man who was coming to me, and he was transitioning. He wanted to transition male to female. And whenever he came to me, he would dress in a skirt and things, and we would talk about it. And his whole issue was he was comfortable about the transition. He was very clear. Uh, she was a girl, but she wanted to actually um, come out to her office because her space was in her office. So she said, what do I do and how do we do it? And we planned it. So she spoke to her HR people. So in office, she always dressed as a male. So she went and she spoke to the HR people, and you won't believe it, the HR people came and met me to ask me to take a session for their 400 employees on LGBT, on transgender, and so that she could come to work as a woman. And yeah, it was amazing. So I went there one Saturday afternoon and we spoke to 400 people and we chatted with them. And one of the biggest only questions with the women employees was, which bathroom is she going to use? So it was like men's bathroom, women's bathroom, which one? Is she coming into the women's bathroom? So that was the nitty gritty. And it was amazing because soon after the session, she started going to work. So what she did was, first she had gone out with some friends. She hadn't come out then. She met two of her best friends. She's a badminton player, so who she would play badminton with. There was a girl and a man. So they went out for a movie, and when she met them at the movie theater, she was dressed as a girl. And so though they were a little stunned for a moment, they sort of, went for the movie, came back, and they went for dinner. And then she said, this is who I am, and this is what I want to be at work. And they were very supportive. Then she went to work, and she came out and she went to work dressed in women's clothes as herself. And then her parents, her father was a doctor and her mother was, I think she was a teacher. So it was to come out to them. So they came to Bangalore, they stayed in a different city. They came to Bangalore, they spoke to me and we spoke about it. And because the father was a doctor, I could talk to him about the technical aspects and all that. And I could see they were trying very hard, but for them, it was like losing their son. They were like, we have one son, one daughter, and now the son wants to be a daughter. You know, as you said, for the parents to have to cope with this whole thing social, and they came from a very traditional village, very traditional family background. And so they were like, okay, let him do all this in Bangalore. But, you know, when he comes back, can he just, you know, wear whatever he wants? You know, let him wear just boys' clothes, please. I said, you know, that's something you people have to work out over a process of time. But I was so delighted with the office because we had the talk. And then she would go as herself and she would dress as a woman and she went to work and team parties and so comfortable. And there was such a lot of support from her office. And I think that's where it makes a difference when you have diversity as a policy and then you actively work on it. And the fact that her HR manager and the HR people were willing to step out of their comfort zone to do that was really, I was amazed. Yeah.
What did they do about the bathroom?
So I don't know what happened because I didn't get to meet them after that. But I have been seeing in Bangalore when I go to cafes now, they have, we are a gender neutral bathroom, or they say unisex bathroom. And, you know, I think that's a step forward.
Yeah,
I wish
that's
that
what all the high schools have to have a gender neutral bathroom now.
not in India yet.
Yeah, well, it's there in paper. It's a work in progress because usually there was never enough bathrooms to build in the first place. And then it's typically it's a staff bathroom that gets moved to a gender neutral.
You know, there's so much gendered binary processes in India that for us to start moving beyond it is so difficult. From the time, forget about the birth certificate with boy and girl, you know, the girl's uniform and the boy's uniform is so different. Then, of course, bathrooms. Then, even things like, you know, to get a girl married, like, you know, if you look at insurance, I mean, these life saving programs which they come in newspapers ads, they're like for your daughter's marriage and for your son's education, and that's what insurance companies are peddling to parents, and jewelry and things like that. So we are still stuck in that, and even having sex determination clinics, we have female feticide is still a huge issue.
Yeah, it's such an ancient culture. You know, Canada is 160 years old. You know, there's not a lot of history there. So, you know, when you have such an ancient culture and such a diverse culture, you know, when that it takes, it's like, you know, a huge cruise ship that's moving. It moves forward, but it's really slow to change angle. It will, but it's, you know, it's such an ancient culture and one in such steeped in such traditions.
Actually,
And when, you know, the house that we live in, this house here, was built before Canada existed.
wow.
You know, and it's not that the house is that old. It's just Canada is very new, so it's a little easier in the sense that you're not having to work with such such ancient traditions. So.
But I'd like to mention here that what we're talking about Indian culture now is a very majoritarianism viewpoint, which has only come up in the last 500 or 600 years and further reinforced, unfortunately, by the entirely Victorian British ideas of morality and sexuality. If you look at, say, for example, tribals in the Northeast, a child born out of wedlock was completely accepted. There was no need for marriage, and the child would be brought up as part of the tribe. In the Santhal tribal cultures in you know, Eastern India, they had things called ghooms where young adolescents would go and stay in a home house, you know, where they stayed together, boys and girls stayed together, lived together. There would have been some amount of sexual explorations. There was no disrespect to sexuality. There was no disrespect to you know, changing partners. There were times during celebrations when they would have sexual activity which was comfortable and not stigmatized. So when we talk of culture in India, sometimes we need to also understand that there is a huge number of cultures which are much more free, much more open, and it's actually the Semitic religions as well as a sort of a more rigid religious dictate which has come in, which is causing a lot of harm.
I recall our first trip to India 34 years ago, and we were in Khajuraho, and since then we've been to many other, we've spent about maybe 12, 13 months in India over a couple trips. And you look at these ancient temples and sexuality is there and it manifests in many ways and forms. And so, yes, I think India is recovering from the colonial period.
Also, also, if you look at the fact that we talk about Kama Sutra, the world of Kama Sutra, and all these temples which we talk about is our ancient culture, and then two students are caught holding hands or kissing in the school and they get expelled, and their parents are berated, where we even have a child committing suicide because the principal upbraided her for talking to a boy who was actually a close family friend. So
Yeah, I think even the idea as India as a monoculture is a myth, completely a myth. I don't know if this is correct, but I've been told that there are 13 alphabets that support over 500 spoken languages. And how can anyone assume that the reason for this plethora of written languages and spoken language would have the same, is an expression of a single culture? Doesn't make sense. And so, to look at India as a single culture is just, it doesn't make sense at all. And that there is a rich tradition where sexualities in all its hosts was recognized, celebrated, and certainly allowed. And so I think many societies are recovering from this Victorian colonial period, of which Canada is a part. We were a part of that as well. So it's wonderful when you have, when Ritesh told us about this group, that this was happening, we were thinking this was really quite amazing. Because how India has changed so much in the 34 years that we've been coming to India. It's extraordinary to see. Bollywood, all that flesh, compared to 34 years ago, we couldn't possibly believe it.
Okay, I have a question that also came up from the anonymous, but it prompts me to ask that. How do we deal with loneliness? I weigh two issues. On one hand, is most people in India don't have their personal space. And on the other hand, they feel lonely in a crowd. How do we account for this? And there are people who do stay alone for work reasons and for otherwise. A lot of us, have work in cities that were not from home, so we're not connected to either parents and families. I think that was the last question too in the anonymous, that when I'm staying alone, how do I make friends? How do I connect? A lot of people aren't even aware. They don't even push themselves out of the boundary and make friends. And I have seen this in every office I've worked in. I've seen this in schools where teachers complain, I feel so alone. And I'm like, why aren't you talking to them? So, one of the ways to get them before we start this, okay, everybody sit in a circle. Let's have chai, coffee, snacks, and only then we'll have a training. Because if they don't feel that connection with each other, they can't achieve whatever they claim to do in their schools. And often the truth about the schools, because I was involved in teacher training for 2 years, I could see this part of the equation, that the more coherent the teachers were, it showed how much socialization was allowed in their schools. And if the teachers themselves didn't socialize, uh, you could be sure that the students were also not. And every other aspect, I'm talking about communication, whether they are able to read, write well in English, especially there, which is not their native language, or doing well in any of the standardized tests, communicating with the other sex, communicating with strangers, all that. So centers around that socialization and loneliness. So do any of you want to weigh in?
I think one of the glorious things right now with social media. I mean, look at us right now. I mean, this is in the morning in Canada. We're talking with you guys, it's absolutely wonderful that we can have these kind of discussions. Chris, all through the pandemic, Chris and I have been doing yoga with a group from people from literally all over the world. And now people can, although we have to be careful because of predators, but I think it's still possible for a lot of young people to meet online and to at least have people, places where they can discuss things safely. What's happening in rural India with internet? Like, can a young man or a young woman in India, do they have their own computer, or what happens in small towns now? I can't hear you.
Ritesh, you're on mute.
More people have access to mobiles in rural India than they have access to personal computers. Because now in the pandemic, the online education is not happening because a lot of them are in areas with very low bandwidth. So you can connect via WhatsApp, you can send messages, you can send material, but they can't attend these live discussions like on Zoom, Google Meet, or any similar apps.
But at least you can connect. It's like I'm thinking about, we have a friend who's a young nurse living in a tiny community about an hour from here, about 3 hours north of Toronto. And years ago, in order for him to meet someone, he would have to drive all the way into Toronto and go to a gay bar. He met his partner, and we're invited to their wedding this summer. His partner lives about 5 kilometers down the road. They would never have been able to meet if it had not been through social media. So what we're finding now here in Canada is that young people are meeting partners in their own communities and not having to move to large urban centers. So I think social media is making a huge difference that way.
I would actually say, while it's available, that as we were talking about knowledge on WhatsApp and Instagram is coming in, we are having a huge upsurge of children watching porn and acting it out. And now we are having more and more young juvenile offenders who are like 14, 12, 13, who have, sodomized or raped a young 3, 4, 5 year old. So having access to inappropriate sexual knowledge or titillating sexual activities with porn without having an understanding of appropriateness, about respect, about consent, about boundaries, about personal boundaries. In the absence of that, it is causing a lot of harm. It is causing a lot of harm.
And that's where the role of the education system comes into play. And that from an age appropriate discussions from a young, grade 3, grade 4. And so I think that's a very, very important role that the educator has in preventing this type of abuse.
But also doctors, I think sexuality now, discussions of sexuality is now mandated through all medical schools. But both Chris and I, who are in our 60s now, we were both badly damaged by experiences with doctors when we were in teens and 20s. It was devastating when the two of us told stories of some of the experiences that we had with doctors when we were very young. It was very, very damaging, and it gets hardwired when these things happen to you when you're young. It gets hardwired into your mentality when someone that you respect, like a doctor or a teacher, says something that's so hurtful and harmful. So it has to happen in the medical schools too, medical schools and the educational system. Yeah.
Going back to the question of how to address loneliness, especially if you're living in a small town, I would be more interested to understand what they think are barriers to making friends. One is, of course, uh, we can always recommend certain things, but are there certain barriers that are there internally which are stopping people from reaching out and making friends? I'm sure several of them may be aware of social media groups and all that, but there may be some beliefs about making friends themselves can be stopping people from reaching out to others. There could be fear of rejection, fear of not being liked, or unless I'm liked by somebody, I cannot be their friend. So there may be some questions about self-esteem that might be stopping people from making friends, or what is the right way to talk. If I'm talking to somebody, I have to keep it interesting all the time, so people become like, they read up all the best of jokes that they want to. So as if they take the onus of keeping a friendship completely on themselves, that friendship is a two-way process. So identifying these kind of errors in beliefs that people hold towards friendships or relationships may be stopping. So before I tell them how to go about, I would rather want them to reflect on what are the barriers that are there, what is coming between them and going ahead and making friends wherever they are.
Yeah,
I
I'll
also
quote something that I read in the morning, and I ended up putting this quote in our chat as well. That every friend was once a stranger, and if you know this, you can understand that conversations are beginning of the connections. I have connected to each one in this group through these different conversations. I think everyone in this room kind of, you know, give a testimony to that. I met David and Chris through a conversation. I met Mohan through a conversation. Dr. Shoiba, the idea of meeting and even including her in this panel came from a suggestion that one of my friends gave me. And all of these are random conversations. And I said, okay, let's start conversing with this person. At worst, okay, they'll say, no, I can't do it, or I don't want to talk. But the best case scenario is you get a new friend. I think the biggest surprises for me is I got my best friend 11 when I joined the office she was working in, and it was quite late for both of us, And like for last 8 years, we have been quite good friends and very close friends. I met Dr. Michael in a random conversation over a bird watching activity. So sometimes you have to explore what unites you. There are a lot of these activities we can do, these social activities that we have to be part of. And a lot of people don't want to be part of these social activities and they complain of being alone. Uh, I find that as a very odd thing that either you be part of something that you be loner, okay, or you complain. You can't do both. Dr. Shoiba, please.
I really agree with what you say is that I need to step out to be a friend, to make friends. But I also see how much people are hampered, children are hampered because they have come from families where caste, religion has played a huge, oh, we don't go to their house, they eat non-veg food, or we can't talk to them because they're from a different religion. And especially in villages, the caste issue is huge. So there are entire communities, people who stay only in this area and those people stay in that area, and you
Mm,
can't come across. And even gender, I have so many times when I take class in school where children say, students of class 8, 9, 10 say, I said, you must talk to boys and girls. You must talk to each other to understand who you are and what you are. Otherwise, how will you know? And they say, please tell our parents. Last time I walk home with a boy who stays near my house, and we walk home together. And my teacher saw us walking, and she complained to my parents, and my mother slapped me for walking with the boy, just walking on the road, walking home from school. So there are so many mindsets we have to change.
good. Uh, I have a question, and this may be for Dr. Shoiba and Mohan in particular. How do people get in touch with groups that cater to LGBT, that cater to women, especially in terms of sexual health, mental health? Are there support groups and are there lists available somewhere?
So if you can Google, there are some resources that you can find. There is one directory called Mingle, MINGLE, mingle to. So that lists practitioners, support groups that are available. If you're living in Bangalore, there are spaces like Good as You BLR. Uh, it has a blog spot which lists down the different resources available in the city. If you're in Hyderabad, you can log on Queer Nilayam, and then again you'll find the resources. On Instagram, you can search using some hashtags. So whatever that is, trans man, trans woman, gender non-binary. So if you put this hashtags, you'll again get connected to different people who are using such hashtags, and then you can then send them personal texts and try to get to know them. YouTube again is a great source for you to connect with people. So a lot of YouTubers make videos about transition, about lived experiences being a certain gender identity or sexual orientation. And if you go on the comments page, again, of course, one has to exercise discretion, like Dr. Sharma was saying earlier. You may become prey to perpetrators if you are not an adult, especially. So taking care of such things, if these are places where you can find people with similar thoughts and feelings.
Dr. Shorba, is there anything you want to add to this?
I would say there's a dearth of knowledge and access for people, particularly the English speaking population in tier one cities may have access, but for rural India, for people who speak any of the Indian languages, very, very difficult. Maybe now Hindi, Tamil, a few are there, but very few, very, very few.
Thanks. May I ask Dr. Mohan to share some of those resources in the chat? So whoever has
Sure,
asked the question can, and for everybody in the group, they can use this.
sure.
Uh, okay. Are there any other questions? I have asked all the questions that was possible. There were many broad, open-ended questions that were addressed as well. For the attendees in the meeting, is there anything you want to ask? You can put in the chat box. If you don't want to directly ask, I'll ask on your behalf, or you can directly ask yourself, unmute yourself.
I do have a question.
Aritra, go on.
My question is, how do you accept yourself or love yourself? Like, for certain times, I feel like, why am I homosexual? I could have been straight. Or there was a phase of mine where I pretended to be straight. For I'm not talking about the years that I was aware of being homosexual and I was pretending to be straight. I'm not talking about those years. I'm talking about the years that I found out that I'm homosexual. Still, I chose to be straight and pretended that nothing has happened and I'm not attracted to it. Just pretended. But in my inner self, that I do know that I was actually attracted to boys. So how do you come out of these things and how do you start to love yourself and not hate for what you are? Like, how do you find self-love?
Anyone?
I think Mohan would go for that.
Yeah.
I don't think there is one easy answer to this. I would say look at how you treat people and see if you're as harsh to others as you are to yourself. And if you are able to be kind and compassionate to your friends, if a friend came to you with a similar difficulties, would you be as unkind and as harsh to them? If you're able to be kind and supportive to them, is it possible that you are being more harsh on yourself than your actual personality is? So can I show, do I deserve the same kind of kindness that I extend to others? Can I question this? That's one important thing. And whatever that you're experiencing right now, is it possible for me to accept, even if it is for a moment, I may have done something, some a mistake? Is it possible in the larger humanity? Is it as horrible as I'm making it out to be? So can I use that to be more kind toward my own self? Does it actually matter 10 years later? Will it still be such a big deal? If I did something wrong, is it as bad uh, when you look at most other people? So can I use this information to be a little more kind to my own self, toward my own self, extend that kindness, compassion that I am readily. Most of us are very, very compassionate toward others, but when it comes to ourselves, we become too critical. So do I not deserve the same kind of kindness? So extending that may be helpful. But again, this is a journey. This will take a long time for you to accept that you also deserve all this. You also deserve love and kindness. But reminding yourself and trying every time that you become a little critical, too harsh on yourself, reminding yourself to allow yourself to make mistake, allow yourselves to go off the track sometimes, and be able to accept yourself.
There's a wonderful book called The Velvet Rage, written by a psychologist in Los Angeles a number of years ago. Have any of you guys read that book? It's an absolutely wonderful book. It's called The Velvet Rage. And I can't remember the author's name, but he talks about the long process of healing that needs to take place. When you think about it, as a child, as a young person, if you recognize you don't know exactly what it is that's different about you than everyone else, but many of us recognize that we were different, and at the same time, many of us felt as children unloved because we couldn't be exactly like everyone else, but we couldn't really understand, why am I not loved? And then this carries through into your middle years and then into your older years, and to recover from that process of feeling unloved as a child, it's almost like you have this developing brain with a little scar, and that how can that brain develop normally when it's got this scar that you've held since you were a little child, since you were a very young child? That's not going to happen overnight. It's going to be a long process. But when it does happen, and it's a very joyous experience. Chris and I have been together very happily now for it'll be 36 years. We're surrounded by wonderful friends, both gay and straight, and in between. And so, for Chris and me in our 60s, it was a long process. And I say we're still working on it now, but it will take a very long time. I would start with a book called The Velvet Rage. I'm going to go upstairs and see if I can find it.
It's in the chat. Yeah, it's in the chat.
I'm going to see if I can. Did you get the author's name?
Yeah.
Okay, and it's a really wonderful book, and it's good for people of all ages. Actually, it's good for young people coming out, but he also has a whole chapter on how to be happy as an aging gay man. And so it's really wonderful, this book. I highly recommend it. It was written quite some time ago, maybe 15 years ago, but it still applies today.
Okay, I have to ask, are there any other questions from the floor?
Okay, so there were really interesting narratives here, and it was really amazing to see some perspectives, some fresh perspectives. So I have seen a trend in the Middle East that the sex ratio in the Middle East is such that there are 3 males for every female. And because of the lack of women over there, men engage in homosexual activities. And that, makes you question whether, like, are you born that way or circumstances make you that way? And I have been through schooling in Dubai. So over there, like, schools are gender segregated, and you have this, as in, boys. So there was a lot of experimenting that I did alone. And when I discussed that with my straight friends now, that you remember back then, we kind of fondled each other over one night. They're like, we don't talk about it anymore. No, that never happened. Hush, hush. It's like swept under the rug. So what is your perspective on it? What is like this thing? How would you define it? What is this phase?
Did I go for that?
Yes.
So sexual feelings are sexual feelings. In the beginning, when you're so they found that boys can have an erection even when they're inside the womb. So there are stimulation which occurs, which causes feelings, hormones to come into the body, and that's why in a way sort of child sexual abuse occurs, because touching of the genitals feels nice, even if you don't have, even if you may not have a sexual feeling per se. um, Children like it. It's like the genitals are made to be touched, so it feels nice to be touched. And I think that importance to understand that it's like having, you know, touching your cheeks or something like that. There is touch is very complete for the body. And as you grow older, between the ages of 3 to 6, for example, children are fascinated, especially in societies where we cover ourselves up in that area. They're fascinated with anything to do with susu, potty, you know, genitals. They want to peep into bathrooms, see what people are doing, and this, you show me yours, I'll show you mine, is so common because they're curious to know about it. So there's a lot of curiosity, exploration. Children want to, you know, pee and see whose pee goes the furthest. And, you know, why do girls sit and pee and why do boys stand and pee? There's so much, you know, exploration happening. In that, when it's touched, it feels nice. It's like sucking your thumb, or, you know, somebody stroking you. It feels not sexual, but I mean, where do you divide sexual? Where's the fine line between just feeling emotionally good about it and sexually feeling good about it? And so this touching is normal. And normally, if you look at, say, in India, where we have, you know, weddings or functions, all the boys are made to sleep in one room and the girls are made to sleep in one room. Because as in India, we all know that putting boys and girls in the same room is dangerous. So we put them separately, not realizing that can be quite dangerous too. So it's natural. So it's very natural to have this sort of a touching. It's very common. I know that in schools and all also, where we have segregated bathrooms of boys and girls, there is a lot of touching among girls and among boys, touching each other. An older boy trying, you know, and that's where the sexual abuse comes in, where the younger one or the one who's lower in authority or power is forced to do something they don't want to. But very often it's just mutual touching, exploring, feeling nice, you know, understanding your own body. In hostels also it goes on. We do know that, you know, when there's temporary, you know, when you're only one gender, like in hostels or in the army or on these NCC camps and things like that, there is a lot of homosexual touching, which may not necessarily mean that the person is either homosexual or not heterosexual or bisexual. It's just, as I said, sexual feelings. And somebody does something to you, you like it, or something happens to you which is done by somebody, and then you want to do it to somebody else if you feel loss of power. So a lot of kids, when they're 7, 8, 9, who were abused sexually by someone older than them, they want to do it when they grow up. They want to do it to somebody younger than them. Sometimes they call it maja, like fun. It's just fun. And sometimes they don't realize the impact may have on the younger person who is not consenting.
Sorry if I didn't frame the question correctly. My concern wasn't with the children. I mean, pedophilia is an issue on its own. But my concern was more with, like, to put it in concrete terms, that there are men who are married with their wife and children in India or Philippines, and these men engage in homosexual activities. They have their families and everything, and then they cheat on the families just out of loneliness or for whatever reason. And would they be considered gay and bisexual, or they are just like straight men, just, like trying to make the best of the situation? I don't know, how do you put it?
So sexual orientation is a very personal identity people give. If those people are willing to identify themselves as gay, bi, it's complete or straight, it's completely up to them. How we say sexual orientation is more or less stable attraction, both sexual as well as emotional attraction people experience toward a certain person. A person could be of any gender. So if it's only like Shava was saying, if there are only sexual behaviors by themselves do not constitute sexual orientation. So there is a major emotional component to it. So that's why sexual orientation is defined as sexual and emotional attraction to a person. So, and again, these are all personal identities. If somebody wants to experience certain sexual activity, does not change their sexual identity as such. So they can still be straight, they can still be gay, they can still be bi. It's up for them to identify. Am I attracted to the act or am I attracted to the person? So that I need to explore. And again, this is for the concerned person to decide for themselves. So we cannot ascribe a label to them.
Okay.
Are there any other questions, Seth, or from anyone on the floor?
So just to continue with that, in India, when HIV programs started, India and I think a lot of parts in Africa also, they did not use the word gay, straight, bi. They started using the abbreviation MSM, men who have sex with men. How they identify is very, very irrelevant. So these are people who have sex with men. The labels can be anything.
Okay, let's end it here on that note. There are also no questions that have come either from the floor or from audience. So thank you everyone. Thanks to our three panelists who have taken time off their busy schedule, a Saturday night, a Saturday evening, for us in India, Saturday morning in case of our panelists from Canada, for David and Chris. So I am really grateful that all of you spent this time. You shared the knowledge gained from your experience and expertise with us. And I hope it has helped answer a few questions, open new vistas to explore ourselves, and maybe get some solutions, maybe get some answers to questions we never thought even existed before. So I personally extend thanks on behalf of Unicorn Voices Toastmasters Club, on behalf of all the attendees, on behalf of those anonymous questioners whose questions you have answered with such depth and knowledge and clarity. Thanks to all of you that you answered the call, because I didn't expect this might even happen even a week ago. But still hoping that if any of you get busy with your work, because you are all such busy individuals. So thank you very much. I know Dr. Shoiba, you have to leave, so I think you should take your leave. Thanks for spending the time and for accepting this one. Of all the people here, she's the one who knows me the least, because at least Chris and David have known me over years, and Mohan has known me in many capacities. But Shoiba took the leap of faith and said, "Okay, I'm going to do it." All it required was a message and a call. That's
If you
that's
tell
how
me
this
it's Saturday evening talking about sex works for me.
This has been a wonderful experience. This has been a wonderful experience for us too. And I can tell you that as soon as this pandemic is over, Chris and I are going to be on a plane back to India. That's for sure. Maybe we'll get to meet some of you in person.
Yes, would love to meet all of you. Thank you so much. It was a great meeting. I really enjoyed it. Thanks so much for inviting me.
Thank you, all of you.
But thanks for organizing this,
This
Ritesh.
Thank you.
Thank you.